Research is hard, but your tools should not be. Subthesis.com is the free alternative to expensive software. Whether you need to calculate Cronbach's alpha or organize your field notes, Subthesis has a tool for it. No paywalls and no registration required. Check the link in the description and let's dive into today's lesson. Welcome back to the Graduate School Prep Series. This video addresses a question I get constantly from people interested in public health careers. Should I get an MPH, a DrPH, or a PhD? The confusion is understandable. All three degrees operate in public health. All three can lead to meaningful careers, but they serve fundamentally different purposes and lead to different outcomes. Choosing the wrong one wastes time, money, and career momentum. I've watched colleagues spend 7 years on PhDs when DrPH programs would have served them better. I've seen practitioners get MPHs when their career aspirations actually required doctoral credentials. By the end of this video, you'll understand exactly what distinguishes these degrees and which one matches your specific goals. This isn't about which degree is better, it's about which degree is right for you. Here's what you'll accomplish in this video. First, you'll understand the distinct purposes, structures, and outcomes of the MPH, DrPH, and PhD in public health. These aren't interchangeable credentials. They're designed for different professional paths. Second, you'll evaluate which degree aligns with your specific career goals, not general public health careers, but your particular aspirations. Third, you'll assess personal factors beyond career goals that should influence your choice. Your work style, life circumstances, and preferences matter as much as your career ambitions. Fourth, you'll understand credential stacking strategies. Many successful public health professionals hold multiple credentials accumulated strategically over their careers. Let's dive into the specifics. Let's start with the MPH, the Master of Public Health. This is public health's foundational professional credential. It's the degree that prepares you to practice public health, to do the work that improves population health. The MPH typically takes 1 to 2 years of full-time study, though accelerated programs exist for those with prior health backgrounds. The focus is applied skills, epidemiology, biostatistics, health policy, environmental health, social and behavioral sciences, and program management. You learn to conduct disease surveillance, design interventions, analyze health data, develop policy, and manage public health programs. The intended outcome is a competent public health professional ready to work in health departments, hospitals, nonprofits, government agencies, and international health organizations. The MPH doesn't train you to be a researcher, though it includes research methods. It trains you to be a practitioner who can use research to inform your work. Think of it as the public health equivalent of an MBA for business or an MSW for social work, the credential that qualifies you for professional practice in the field. The DrPH, Doctor of Public Health, is public health's leadership doctorate. While the MPH prepares practitioners, the DrPH prepares executives. It's designed for experienced professionals who want to lead at the highest levels. The DrPH typically takes 3 to 5 years to complete, but many programs accommodate working professionals through part-time and executive formats. This matters because the degree is designed for people who already have significant public health experience, not for those entering the field. The focus is leadership, policy, research translation, and systems change. DrPH programs emphasize organizational leadership, health policy analysis, translating research into practice, and driving population-level change. The dissertation often addresses real-world problems through applied research. The intended outcome is a public health executive capable of leading health departments, designing state or national policy, directing major organizations, and driving systemic improvements. Think of the DrPH as preparation for roles like state epidemiologist, health department director, chief public health officer, or senior policy leader. These positions require more than clinical or technical expertise. They require the leadership capabilities the DrPH develops. The PhD in public health or related fields represents the research doctorate. This is the scholar's degree designed to produce original researchers who advance the science of public health. PhD programs typically require 4 to 7 years of full-time study. Unlike the DrPH, Most PhD programs expect you to leave the workforce and commit fully to doctoral training. Part-time PhD study is rare and generally discouraged. The focus is original research methodology and theory. PhD students learn to design rigorous studies, develop new methods, test hypotheses, and contribute to the theoretical foundations of their subfields. The dissertation must make an original contribution to knowledge, adding something new to what humanity understands about health. The intended outcome is an independent researcher capable of leading research programs, obtaining grants, publishing in peer-reviewed journals, and training the next generation of researchers. The PhD prepares you primarily for academic faculty positions at research universities and for research leadership roles at agencies like the CDC, NIH, or research institutes. If you want to teach at a university and build a research program, the PhD is your path. If you want to lead health departments and drive policy, it's probably not. Let me put these side by side so the distinctions are crystal clear. The MPH is about practice. It takes 1 to 2 years. The core competency is applying existing knowledge to public health problems. You learn to use the tools that researchers have developed. The DrPH is about leadership. It takes 3 to 5 years. The core competency is translating research into action and leading organizations that improve population health. You learn to bridge science and practice at scale. The PhD is about research. It takes 4 to 7 years. The core competency is creating original knowledge through rigorous research. You learn to advance the science that others will apply. None of these is better than the others. They're different tools for different purposes. A hammer isn't better than a screwdriver. It depends what you're building. Similarly, these degrees aren't better or worse than each other. It depends what career you're building. The problems occur when people choose a degree mismatched with their goals, a PhD when you want to lead health departments, an MPH when you want a research faculty position, a DrPH when you want to spend your career in the lab. Match the degree to the career, not to what sounds most impressive. Let's examine specific career pathways for each degree. With an MPH, common career paths include epidemiologist positions at local or state health departments. You conduct disease surveillance, investigate outbreaks, and analyze health data to guide interventions. Program management at nonprofits is another natural path. You design, implement, and evaluate health programs serving specific populations or addressing particular health issues. Health policy analysis draws many MPH graduates. You research policy options, assess their impacts, and advise decision-makers on health-related legislation and regulations. Hospital quality improvement offers clinical adjacent careers. You analyze patient outcomes, identify improvement opportunities, and lead quality initiatives. Global health program coordination appeals to those with international interests. You work with organizations like USAID, WHO, or international NGOs to implement health programs in resource-limited settings. The MPH qualifies you for all of these roles. You can have a fulfilling, impactful, well-compensated career with an MPH as your terminal degree. Many of the most important public health work gets done by MPH-level professionals. DrPH careers focus on executive leadership. Health department directors lead local or county public health agencies. They set strategy, manage large teams, navigate politics, and serve as the face of public health in their communities. State or local health officers carry even broader responsibility, often serving as chief medical advisors to governors or county executives during health emergencies. Chief public health officer positions in hospital systems are growing. Health systems recognize that population health management requires someone who understands public health, not just clinical care. Senior policy advisor roles place DrPH graduates at the intersection of research and policy. You translate scientific evidence into actionable policy recommendations for legislators, governors, or agency heads. Executive directors of major health nonprofits need the leadership skills the DrPH provides. Organizations like the American Heart Association, state public health associations, or major health foundations need leaders who understand both the science and the practice. Notice the theme. These are leadership positions. They require the ability to set direction, manage organizations, influence policy, and drive change at scale. The DrPH prepares you for these responsibilities in ways the MPH and PhD do not. PhD careers center on research and academics. University faculty positions are the traditional PhD outcome. You teach courses, mentor graduate students, conduct research, publish papers, and pursue grants. Tenure-track positions are competitive but remain the gold standard for academic careers. Research scientist positions at agencies like CDC, NIH, or state health departments conduct the studies that inform public health practice. These roles require PhD-level methodological training. Principal investigators at research institutes lead major funded studies. You design research programs, obtain grants, manage research teams, and produce publications that advance the field. Industry research and development offers growing opportunities. Pharmaceutical companies, health technology firms, and consulting organizations hire PhDs to lead evidence generation and research strategy. Global health research directors at organizations like the Gates Foundation or major international NGOs design research agendas that shape global health priorities. These roles require the scientific credibility that comes with doctoral research training. The common thread is research. PhD careers are built around the production and leadership of original research. If research isn't your central interest, the PhD path is probably wrong for you, regardless of its prestige. Many successful public health leaders accumulate credentials strategically over their careers. This is credential stacking. The MPH typically comes first. It provides the foundational public health competencies everyone in the field needs. Whether you eventually pursue doctoral education or not, the MPH establishes your public health identity. After gaining professional experience, some pursue doctoral credentials. If your career has moved toward leadership and you aspire to executive positions, the DrPH makes sense. If you've discovered a passion for research and want to transition to academia, the PhD makes sense. Timing matters considerably. Many DrPH programs explicitly prefer candidates with 5 or more years of professional experience. The experience enriches your doctoral work and ensures you understand the context you're being trained to lead. PhDs benefit from experience too, though programs more commonly accept early career applicants. Additional certifications complement degrees. The Certified in Public Health Credential, Project Management certifications, Healthcare Administration credentials, and similar qualifications add specific competencies to your portfolio. Don't think of your education as a single event. Think of it as a career-long journey of capability building, with different credentials serving different purposes at different stages. Your orientation toward research is perhaps the most important decision factor. Ask yourself, do I want to consume research or produce it? MPH graduates are skilled consumers of research. You read studies, evaluate their quality, and apply their findings to practical problems. You use research as a tool for decision-making. This is valuable and important work. DrPH graduates translate research into practice and policy. You bridge the gap between what researchers discover and what practitioners implement. You understand research well enough to evaluate it critically and communicate it clearly to non-researchers. PhD graduates produce research. You spend your career designing studies, collecting data, analyzing findings, and publishing papers. Research isn't a tool you use, it's the work you do. Be honest about where you fall on this spectrum. Some people love the process of research, the puzzle solving, the methodological rigor, the discovery. Others respect research but don't want it as their central activity. There's no wrong answer, but self-awareness matters. If you pursue a PhD despite being practice-oriented, you'll struggle through years of research training that doesn't fit your interests. Your career aspirations should heavily influence your degree choice. What positions do you ultimately aspire to? Not in 5 years, but at the peak of your career. What do you want to be doing? Once you've identified target positions, research their actual requirements. Don't rely on assumptions. Look at job postings for those positions. Look at the credentials of people currently in those roles. Ask people in those positions what they recommend. Some positions have specific requirements. University faculty positions require PhDs. State epidemiologist positions often require doctoral credentials. Certain leadership positions explicitly require DrPH or equivalent preparation. However, many positions have flexible requirements. They might prefer doctoral credentials without requiring them. They might accept either DrPH or PhD. They might value experience more than specific degrees. Understanding where your target positions fall on this spectrum helps you make efficient decisions. If your dream job is achievable with an MPH, the additional years for a doctorate may not be justified. If it requires a doctorate, you need to plan for that extended investment. Time and money constrain choices regardless of preferences. The MPH requires 1 to 2 years and costs $30,000 to over $100,000 depending on the institution. Most MPH students pay for their education through loans, savings, or employer reimbursement. Full funding is rare. The DrPH requires 3 to 5 years. Funding varies considerably by program. Some offer assistantships. Some are designed for working professionals who continue earning while studying part-time. The financial burden is typically moderate but present. The PhD requires 4 to 7 years. The good news is that legitimate PhD programs typically offer funding, covering tuition, and providing a living stipend. The bad news is that stipends are modest and you'll likely earn far less than you would in the professional workforce. Opportunity cost multiplies with program length. The additional years spent in doctoral programs mean additional years of reduced income or student stipends instead of professional salaries. By the time a PhD completes training, an MPH graduate might have 7 or 8 years of career advancement and earnings. Make sure the investment makes sense for your specific situation and goals. Your work style preferences matter more than many people acknowledge. Do you prefer action and implementation? Do you want to run programs, manage teams, and see direct impact? The MPH leads to action-oriented careers where you do public health work day to day. Do you prefer leadership and systems change? Do you want to set direction, influence policy, and create conditions for others to succeed? The DrPH prepares you for positions where your impact comes through the organizations and systems you lead. Do you prefer inquiry and discovery? Do you love the research process, the deep dive into questions, the methodological problem solving? The PhD leads to careers centered on research as the primary activity. Also consider your preference for structure versus ambiguity. MPH programs are relatively structured with clear coursework and timelines. PhD programs involve extended periods of unstructured research work with ambiguous progress markers. DrPH programs fall in between. If you need external structure and clear milestones, the years of independent doctoral research may be challenging regardless of your career goals. Dual degrees offer another pathway worth considering. These programs combine the MPH with other professional credentials. The MD-MPH prepares physicians who think beyond individual patients to population health. Physician leaders in health departments, hospital systems, and policy organizations often hold this combination. The MPH-MBA combination develops health management leaders. If you want to run hospitals, lead health systems, or direct major health organizations, this combination provides both the health content and management skills you need. The JD-MPH combination prepares health law and policy specialists. Health attorneys, policy advocates, and regulatory specialists benefit from understanding both legal frameworks and public health science. The MSW-MPH integrates clinical social work with public health practice. Community health workers, behavioral health program leaders, and social determinants experts often hold this combination. Dual degrees take longer than single degrees but less time than earning degrees separately. They create distinctive professional profiles that stand out in competitive job markets. If your interests genuinely span 2 fields, explore whether a dual degree program might serve you better than a single credential. Let me identify common mistakes so you can avoid them. Choosing based on prestige rather than fit is perhaps the most common error. The PhD sounds more impressive than the DrPH or MPH, but prestige is irrelevant if the degree doesn't serve your actual goals. People will judge you by your professional accomplishments, not your credential letters. Getting a PhD when you want a practice-oriented career wastes years of your life. I've watched talented practitioners spend 6 years earning PhDs for positions they could have obtained with MPHs. The PhD didn't enhance their careers, it delayed them. Skipping the MPH when foundational training would help is another mistake. Some people jump straight to doctoral programs without the public health foundation the MPH provides. They struggle with basic concepts their peers mastered years earlier. Rushing into doctoral programs without professional experience often leads to regret. Experience clarifies what you actually want and provides context for advanced study. The 25-year-old certain they want a PhD sometimes discovers at 30 that their interests have shifted entirely. Experience before doctoral study reduces this risk. Pause and honestly answer these questions. Where do you want to be in 15 years? Not where you think you should want to be. Where do you actually want to be? Running a health department, teaching at a university, leading research at the CDC, managing programs at a nonprofit? Your answer guides your degree choice. What does your ideal workday look like? If it involves meetings, strategy sessions, and organizational leadership, you're describing DrPH territory. If it involves data analysis, grant writing, and mentoring graduate students, you're describing PhD work. If it involves program management, community engagement, and direct public health action, you're describing MPH level practice. Are you genuinely drawn to research as a career, not as something you can tolerate, but as something you actively want? If research excites you, the PhD makes sense. If research sounds like a means to an end, other paths may serve you better. What credentials do your role models hold? Look at people who have the careers you want. What degrees do they have? What paths did they take? Their trajectories offer clues about what credentials actually matter for your goals. Here's a simplified decision matrix. If you want to practice public health to do the work of epidemiology, program management, policy analysis, or health education, start with the MPH. It's the foundational credential for practice careers. You can have a complete, successful career at this level. If you want to lead public health organizations, to set direction and drive systemic change from executive positions, consider the DrPH. This is especially true if you already have significant experience and know that leadership is your trajectory. If you want to conduct research as your primary professional activity, to produce new knowledge through rigorous scientific inquiry, pursue the PhD. This is the credential for academic careers and research leadership. If you're uncertain, which is completely valid, get the MPH first and then reassess. The MPH takes less time, costs less money, and keeps your options open. After 2 years of graduate study and some professional experience, your preferences will be clearer. Take these concrete next steps after finishing this video. First, identify 5 specific positions you aspire to, not general career fields, but actual job titles at actual organizations. Health Department Epidemiologist, University Professor, Hospital Chief Population Health Officer. Be specific. Second, research the credential requirements for each position. Look at recent job postings, review the qualifications of people currently in those roles. Determine whether credentials are required, preferred, or flexible. Third, talk to at least 3 professionals currently in positions similar to your goals. Ask them about their educational paths. Ask what they'd recommend to someone with your interests. Ask what credentials actually matter in their day-to-day work. Fourth, honestly evaluate your research orientation. Do you want to produce research as your primary work, or do you want to apply and translate research produced by others? Your answer strongly indicates whether doctoral education and which type makes sense for you. Armed with this information, you'll be ready to make a well-informed decision about your public health educational path. Let's summarize the key points. The 3 public health degrees serve distinct purposes. MPH prepares practitioners, DrPH prepares leaders, PhD prepares researchers. They're different tools for different career paths. Match your degree choice to your actual career goals, not to what sounds most prestigious. The most impressive credential is the one that enables the career you actually want. Credential stacking over your career is often the strategic approach. Start with the MPH, gain experience, then pursue doctoral education if your trajectory warrants it. Most successful public health leaders built their credentials progressively. When uncertain, start with the MPH. It takes less time, costs less money, keeps options open, and provides foundational competencies useful across all public health paths. You can always pursue doctoral education later with greater clarity. In our next video, we'll explore how to research graduate programs effectively. Once you know what type of degree you want, you need to find the right program for your goals. Thank you for your attention, and I'll see you in the next video. Writing the thesis is a marathon, not a sprint, but you do not have to run it alone. If you are feeling stuck with your data or overwhelmed by your sources, let us help. Head over to subthesis.com. It is completely free and designed to make your life easier. You are making progress. Keep going. And don't forget to subscribe for more support.